Should I use heat or ice for my back pain? Watch this video to never be confused again. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of other people, perhaps like yourself, who also have back pain. My advice is a mixture of my professional expertise and personal experience, and I focus on giving information I wish I had known when I was suffering from back pain. So just a short video today to answer the very common question, should I use heat or ice for my back pain? Before I provide you with the information to help you make your decision, I'd be very interested to know, do you use heat or ice for your back pain? And which do you find more valuable? Put it in the comments below. I'd be very interested to hear your opinions. So the decision whether to use heat or cold in the treatment of your back pain should be based on careful consideration of the specific condition, the stage of the injury, and your therapeutic goals. So of course, it can be valuable to have a basic understanding of the underlying mechanisms and physiological effects of application of heat and cold in order to make an informed decision. However, there is some essential advice which almost trumps everything, which I'll say for the end, so make sure you stick around for that. So firstly, ice, or if you want to use the fancy term, cryotherapy. So this tends to be more useful during the initial acute phase of back pain when there is inflammation, swelling, or recent tissue damage. And this normally occurs in the first 48 to 72 hours post-injury. So applying cold to an area has several effects. Firstly, vasoconstriction. So the application of cold can constrict the blood vessels. This reduces blood flow to the area, which can help to minimize inflammation and limit potential swelling. So this is particularly beneficial in the early stages of an injury. Another reason the application of cold can be particularly beneficial is for the numbing effect or local anesthesia. Now, sometimes these are considered to be separate, but practically speaking, in my experience, most patients consider these to be the same impact. So the application of cold or ice can provide temporary relief by providing a slight numbing effect, which can alleviate pain and discomfort localized to the area. Related to this, or another way of saying this, is that cold temperatures can provide a local anesthetic, reducing nerve conduction and helping to control pain signals. So when using ice or cold or cryotherapy, make sure you follow the appropriate guidelines to minimize potential complications. Please make sure you always use an ice pack covered in a thin cloth to protect the skin from direct exposure, and limit each application to about 15 to 20 minutes at a time, allowing the skin to recover its normal temperature between each subsequent application. I know it's tempting to think more is better when it comes to the application of cold or ice. I've made this mistake many times myself, but I promise you the potential damage or injury to your skin is not worth the risk, and you won't be getting any extra benefit. So on the flip side of the coin, the application of heat is normally more valuable in the treatment of muscle tightness, stiffness, and non-inflammatory discomfort. This tends to be more relevant more than 2 to 3 days after the initial injury. The application of heat can have several benefits. Firstly, muscle relaxation. So heat can help muscles relax by improving blood flow. So in essence, the opposite of what cold therapy does. This can help deliver oxygen and nutrients to the affected area while removing waste products. Secondly, and the reason in my experience most people do tend to turn to heat therapy, pain relief. So the warmth of heat therapy can provide a comforting sensation, which can help to relieve muscle spasms and also reduce the perception of pain. And the final reason for using heat therapy, muscle elasticity. So heat can increase the extensibility of tissues. This can make an excellent choice for conditions where improved flexibility and increased range of motion are desired, and this is often the case in certain types of back pain. Like with cold therapy, it's important with heat therapy to not utilize excessive temperatures that can damage or burn the skin, and similar advice, only apply for about 15 to 20 minutes and then allow the skin to regain or recover its initial temperature before applying again. Of course, with heat therapy, you can use heat pads or hot water bottles or things like that. But in my experience, a lot of people with back pain often like to use a more sort of generalized heat therapy across the whole body, something like a hot or warm shower, or a nice, soothing, relaxing bath. You can probably tell from my smile, that's one of my personal favorite options. So in short, really simple advice. Use cold in the initial stages of an injury, the acute phase, normally about 2 to 3 days after the incident, and use heat after that if you need to decrease muscle tension or increase elasticity. Generally speaking, it's really about that simple. Please remember that, like almost everything with back pain, individual responses can vary. So when applying heat therapy or cold therapy, please remember to listen to your body for appropriate feedback. At the start of the video, I promised you some advice that would trump absolutely everything, and here it is. If it feels good, it probably is good. So what I mean by that is, despite everything I outlined above and the reasons and physiological effects of heat therapy and cold therapy, most practitioners will recommend the advice of, if it feels good, do it. So even if you're in that acute phase of the injury, 1 or 2 days, but heat just feels right for you, in the majority of cases, that's going to be absolutely fine. And on the flip side, vice versa, if you are in the sort of more chronic stages of an injury, or at least out of the acute stage, and cold just feels right, that's probably just fine. So after hearing that information, has your opinion changed at all? Were you previously using ice and you might want to try heat, or vice versa? Let me know in the comments below. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a thumbs up and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your road to recovery. Thanks again for watching the video, and I'll see you in the next one.